Some healthcare facilities in rural areas say they lack resources and staff. One organization says medical volunteers can bridge the gap. It says the goal is not for volunteers to take over the facilities, but to support patients and existing staff. Let's discuss this with John Gear from the Tshemba Foundation. Thank you very much, Mr. Gear, for your time. Now, exactly how do we deal with, especially our public health system, where even before the coronavirus arrived in the country, nurses and staff there have always complained that they don't have PPE. So this only became a big highlight when COVID-19 became a problem in South Africa. But these are problems that have existed before.
Thanks very much. Thank you for having me. And yes, I think rural hospitals and rural clinics certainly are the orphan children in any story, and rural communities are the orphan children. So there is a need, I think, for government to recognize extra effort is required. There is a need for material injection. There's a need for human resource injection as well. Often one of the greatest problems is not so much the actual facility or whatever it is, but it's people to make optimal use of the facilities that are available. And our patients tend to have to wait for many hours and queue for a long time after traveling a long way just to see a doctor, because there are so few doctors and outpatients. And that's how our volunteer program at Tshemba Foundation tries to support and help.
Exactly what would the volunteers be doing? Some people would trust only a nurse or only a doctor, or at least a community healthcare worker. So what would be the difference with the volunteer compared to, for instance, a community healthcare worker?
Okay, I think, let me be clear. Our volunteer program is recruiting health professionals. So these might be doctors and nurses working in other parts of South Africa, for example, people in the cities who would like to come out and just do a little bit extra in return for the privileges that they enjoy. So our volunteer program is entirely made up of fully qualified health professionals. So often our volunteers have better qualifications than the staff with whom they're going to work. That doesn't mean that they have the similar rural, rich experience and understanding. So it's very much a team effort, with Tshemba providing some new insights, some additional wisdom. And when we're lucky, our volunteers actually stay for extended periods, particularly the international volunteers. And then they're able to build up a relationship with staff, with patients, give advice about systems, and in return, learn new things about a different part of the world.
How has government reacted or reciprocated this initiative?
Look, it's been extraordinary. Obviously, any negotiation with bureaucrats, and we get pretty bureaucratic as well, is always complex. But we have a very good memorandum of understanding with the Mpumalanga Department of Health, as most of our efforts are focused on Mpumalanga. We're a little bit involved informally with non-professional organizations, non-profit organizations in the Limpopo province, but essentially we are an Mpumalanga-based volunteer program at this stage. And we have this memorandum of understanding. They come to the party in many ways. Some of the significant programs we have are a cataract service. There's a huge waiting list for cataracts. The estimates are anywhere between 18 and 20,000 on the waiting list. And we have volunteers coming in, particularly from Johannesburg, actually, but also internationally, who come, and we have equipped the theatre, we've equipped the eye clinic. But Province provides all the consumables, and Province has committed to providing nursing staff. Now, it's one thing to commit, it's another thing to be able to fulfill that commitment. But the goodwill and the intention is there. And we work well with Province, but any government department is slower than activists and passionate people like me like. So we do get impatient, but I'm sure they get impatient with me. So there's probably dual respect, but also dual suspicion.
How did the coronavirus affect your services? I mean, for instance, you're saying you'd get people from Johannesburg helping, for instance, either in Mpumalanga, where you're mostly based, or Limpopo, where you work with NPOs, right? But there was a level 5 lockdown and 4, I think, up until 3, where inter-provincial travel was not allowed. So how were you affected in terms of that?
Look, I think healthcare was devastated. We had to respond to the coronavirus, particularly in the early days when our understanding was somewhat limited. And, you know, we can look back with hindsight and say, oh, that was bad or this was good or whatever. But at the end of the day, the impact was massive. It meant that we had volunteers here who were worried about never getting back to the UK and who left early. We had some brave volunteers who decided to throw in their lot with South Africa, and they stayed, and they made an enormous difference. But perhaps the most devastating thing about the epidemic and the very severe lockdowns was that people were terrified to come to the hospital. And people with other conditions who should have been coming, instead of presenting early enough to, you know, receive an antibiotic and go home again, were having to come in for surgery, for major infections and whatever, at a very acute stage, and where the hospital's facilities were massively overstretched. Government took a stance, which I'm not sure that I had agreed with, in that all their public servants would only work sort of skeleton staff, which meant that it was a 50-50 call in how many staff were on at any time. That was devastating, and I'm not sure that there should have been an exemption that health workers should not have been a part of that. But many of our departments in the hospital were working on 50% skeleton staff at a time when we perhaps needed more staff, and because everything takes longer. You've got to put on a mask, put on a gown, put on gloves. All that takes time. So, yes, we've learned a huge amount, but the effect was devastating.